Thanks for joining us today. Welcome to the Center for State's video series on implementation planning and capacity building. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Implementation Planning and Capacity Building Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to planning the implementation of an activity, program, or intervention to address a problem or need, and consider strategies to building agency capacity to implement it. It does this by providing step-by-step guidance to prepare for implementation, make a plan for addressing any gaps in capacity or capitalizing on strengths, and then develop a plan for implementation that includes the actions needed to get ready, actions needed to implement, and actions to measure implementation progress. Implementation planning and capacity building is broken down into 3 parts and 8 essential functions, or steps, that may be presented linearly, but they often overlap, and teams will loop back and forth between them. At this point, teams should have outlined the elements to include in their plan, identified the sources to pull the information from and considered the context and how it may impact implementation, then revisited their teaming and leadership structure, reviewed readiness assessment findings, and developed strategies to build capacity and strengthen motivation for implementation. In this module, we look specifically at building the work plan activities around getting the intervention ready before implementation. Activities to get the agency ready is addressed by Module 8 in this series. Before moving on to Part 3, building the work plan activities to prepare the agency, and then activities to roll out and measure the intervention, to communicate and engage stakeholders, and then consolidate the plan as needed. Let's get started. Why do teams identify activities in the work plan that will get the intervention ready? To ensure that the intervention is well defined and can be implemented consistently with quality. To identify what, if any, tasks are needed to make the intervention well defined before implementation, and to start thinking about how the team will monitor and evaluate the implementation of the intervention. And to address cultural or contextual issues before implementation and identify how youth, families, and system partners will be involved in planning. What cultural or contextual information can the agency anticipate, and how can they proactively address them? How will youth, families, and system partners help to shape the planning? The work plan provides a detailed account of the necessary tasks and activities to support implementation. Team members should develop a consistent framework for the work plan that outlines key tasks or activities that will prepare the intervention for implementation and document each of the following: projected timeframes for the task, notes on necessary preconditions, interdependencies between tasks, and sequencing of steps. For example, does some level of training need to occur before coaching and supervision of the intervention can be outlined? Milestones, such as specific products or indicators of completion, and the individuals or groups responsible for completing the tasks or activities. Teams should begin implementation with a well-defined and usable intervention that has the following elements: a clear description of the intervention, core components or the key building blocks of the intervention that lead to positive outcomes, operational definitions of the core components that include specific actions and behaviors required to carry out the intervention, and practical performance assessment processes to enable monitoring of the intervention's implementation. Teams may already meet these criteria and have related materials and core components such as practice profiles, program guidance or manuals, and existing assessments if they are replicating a well-defined, evidence-supported intervention, or if they've done design work in a prior phase of the change process. If teams do not yet have a well-defined intervention, or if their selected intervention needs to be adapted to meet the needs of the target population or setting, then teams should identify any action steps and timelines in their implementation plans that will prepare the intervention for implementation, including adapting or refining core components to meet the needs of the target population and setting, preparing, adapting, and/or finalizing program materials, for example, practice profiles or program guidance, to make the core components explainable, teachable, doable, and measurable. And reviewing program materials with key stakeholders, including target population members and system partners. When teams are identifying work plan activities to get the intervention ready, they should consider the following. Is the intervention well defined and adapted as appropriate for the setting and target population without offsetting the integrity of core components? Have any cultural or contextual issues been addressed? And how are members of the target population and system partners included in the planning? Teams should identify what, if any, tasks are needed to prepare the intervention to be well defined. What activities and tasks are dependent on one another, what order they need to occur in, who is responsible for them, and in what time frame they need to happen to implement the intervention. Teams that incorporate these considerations into their implementation planning will help ensure that the intervention is well defined and appropriate for the setting, target population, and context, and that roles, responsibilities, and key tasks to do this are clearly defined. Let's take a few minutes to check in on an example of identifying activities that will prepare the intervention for implementation. Before implementing a new differential response system, the Ohio Differential Response Leadership Council identified core components and developed practice profiles that aligned with their agency culture and context and to meet the needs of their target population. Based on this, they outlined the following key categories of practice for the model and the ideal, developmental, and unacceptable behaviors associated with each in order to prepare the intervention for implementation. Engaging were the behaviors to effectively join with the family to establish common goals concerning child safety, well-being, and permanency. Assessing were the behaviors to gather information about reported concerns and family needs, evaluate the relevance of that information, and identify family strengths and community resources that may be applied to address those concerns and needs. Partnering were the behaviors for respectful and meaningful collaboration with families to achieve shared goals. Planning included behaviors for setting goals, developing strategies, and outlining tasks and schedules to accomplish the goals that come out of the engaging, assessing, and partnering process. Implementing what behaviors supported identifying and applying the most effective and culturally appropriate services, resources, and processes to meet the goals established in the planning stage. Evaluating behaviors to monitor outcomes of service plans and system programs to determine if the desired goals are being achieved, and if not, using that information to either reconsider goals or strategies developed in the planning phase or services and resources identified in the implementation stage. Advocating were behaviors for how to recognize individual or group needs, provide intervention on behalf of a client or client group, communicate with decision makers, and initiate actions to secure or enhance a needed service, resource, or entitlement. Demonstrating cultural and diversity competence. These were behaviors that support interacting with families without making assumptions, respecting and learning from the unique characteristics and strengths of the family while acknowledging and honoring the diversity within and across cultures, and applying these skills to the partnership with the family and the options made available to them. Communicating included behaviors for effective sending and receiving of information within the appropriate cultural context, including verbal, nonverbal, electronic, and written communication methods. And collaborating. These were behaviors that support establishing and maintaining mutually beneficial and well-defined relationships with community partners to achieve goals of safety, permanence, and well-being for children and families. Let's take a moment to check in on what you've learned about identifying work plan activities that get the intervention ready for implementation. Why do teams identify work plan activities that get the intervention ready? To ensure there is a well-defined intervention for implementation, that it is appropriate for the context and setting, and that implementation efforts can be monitored and evaluated. How do teams identify work plan activities that get the intervention ready? By reviewing materials and any previous work on the selected intervention and ensuring that the intervention is well defined. What can help teams identify work plan activities that get the intervention ready? By considering if the selected intervention is well defined and appropriate for the target population, setting, and context, and if not, what activities are needed, who is responsible, and when they need to occur. Now take this a step further by reviewing the reflection questions for identify work plan activities that get the intervention ready in your implementation planning and capacity building workbook to connect what you've learned to your own experience. Up next is build a work plan. Identify activities to get the agency ready, the 8th module in this series, and the second half of this function in implementation planning and capacity building.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.